Hello, and welcome to my presentation on Parkinson's disease. Parkinson's disease is a progressive neurological disorder that primarily affects movement control. It is characterized by symptoms such as tremors, stiffness, bradykinesia, which is a slowness of movement, and postural instability. The disease results from the degeneration of neurons in the substantia nigra, a region of the brain responsible for producing dopamine, a neurotransmitter crucial for coordinating smooth and balanced muscle movements. Understanding the specific brain regions impacted by Parkinson's, such as the basal ganglia and motor cortex, is essential for developing effective treatments and improving patient care. Learning about Parkinson's not only enhances our knowledge of this debilitating disease, but also underscores the importance of early detection and intervention. Moreover, it fosters empathy and support for those affected by the condition. Studying Parkinson's disease and the affected brain regions is vital for advancing medical research and treatment strategies, ultimately aiming to improve the lives of those living with this challenging disorder. Parkinson's disease does not begin in the substantia nigra as commonly thought, but instead in other brain regions. A study of 30 autopsy cases with incidental Lewy body pathology found that the disease starts in non-catecholaminergic neurons, particularly in the dorsal glossopharyngeus vagus complex, intermediate reticular zone, and specific areas like the olfactory bulb and anterior olfactory nucleus. These regions, part of the brainstem and olfactory system, show the first appearance of Lewy nucleates and Lewy bodies, which are markers of Parkinson's disease. Interestingly, the substantia nigra typically associated with Parkinson's disease is not involved in these early stages. The study highlights that Parkinson's disease affects specific nerve cell types in the brainstem before reaching other areas traditionally linked to the disease. In contrast, the known
encephalic sites, including the hippocampus, amygdala, and hypothalamus, show no early signs of Lewy pathology in this sample. Parkinson's disease primarily affects the substantia nigra, a region in the midbrain responsible for producing dopamine, a neurotransmitter crucial for regulating movement. In Parkinson's, the neurons in the substantia nigra progressively degenerate and die, leading to a significant reduction in dopamine levels. This decrease in dopamine disrupts the normal communication between the substantia nigra and other brain regions involved in movement control, such as the basal ganglia. The result is the hallmark motor symptoms of Parkinson's, including tremors, muscle rigidity, and bradykinesia, which is a slowness of movement, as the brain struggles to coordinate smooth and controlled muscle movements. This information can be used to better understand the neurological basis of Parkinson's disease, which can help in various ways. For medical professionals, this knowledge aids in diagnosing and treating the condition more effectively by targeting therapies that address the underlying dopamine deficiency. Caregivers and families can gain insight into the challenges faced by individuals with Parkinson's, fostering empathy and improving caregiving strategies. Additionally, researchers can apply this understanding to explore new treatment avenues or develop interventions aimed at slowing the progression of neuronal degeneration in the substantia nigra, ultimately enhancing the quality of life for those affected. The basal ganglia is a group of nuclei in the brain that play an important role in regulating voluntary motor control, procedural learning, and routine behaviors. In Parkinson's disease, the basal ganglia's function is disrupted due to decreased dopamine levels from the degeneration of the substantia nigra. The basal ganglia have distinct pathways: the direct pathway, which facilitates movement, and the indirect pathway, which inhibits movement. In Parkinson's, the balance between these pathways is altered, with the indirect pathway becoming overly active, leading to increased inhibition of movement. This information can be used to gain a deeper understanding of how Parkinson's disease affects movement and motor control, which is critical for both medical professionals and caregivers. For clinicians, this knowledge informs the development of targeted treatment strategies aimed at restoring the balance between the direct and indirect pathways in the basal ganglia. For caregivers and family members, understanding the role of the basal ganglia can help them better support individuals with Parkinson's, recognizing the challenges they face in executing even routine movements. The motor cortex, located in the frontal lobe of the brain, is responsible for planning, controlling, and executing voluntary movements. In Parkinson's disease, the motor cortex is indirectly affected due to the disruption of communication between it and the basal ganglia, caused by decreased dopamine levels from the degeneration of the substantia nigra. This disruption leads to difficulty in initiating and controlling movements, resulting in the characteristic motor symptoms of Parkinson's, such as bradykinesia, muscle rigidity, and tremors. The impaired function of the motor cortex contributes to the overall difficulty in performing coordinated and smooth movements in individuals with Parkinson's disease. This information can be used to better understand the challenges faced by individuals with Parkinson's disease, particularly in terms of movement and coordination. For healthcare professionals, this knowledge is vital for developing targeted therapies that aim to improve motor function by addressing the disrupted communication between the motor cortex and basal ganglia. Parkinson's disease significantly impacts lifespan, leading to a shortened life expectancy due to its progressive nature. Beyond the physical challenges, the disease imposes substantial economic burdens, including loss of income, costs of care, and ongoing drug treatments currently estimated at $1.1 billion globally. One of the major issues is the delayed diagnosis. By the time symptoms appear, 70 to 80% of dopaminic neurons are already lost, which limits treatment effectiveness. This long pre-symptomatic phase makes early intervention difficult but crucial. The primary challenge for researchers and clinicians is to slow or halt the progression of the disease by protecting these neurons. Early detection and treatment aimed at rescuing vulnerable neurons could potentially improve outcomes. Understanding the variable incubation time of the disease is essential for developing preventative strategies. Addressing these challenges is key to improving both the lifespan and quality of life for individuals with Parkinson's disease. Parkinson's disease is a progressive neurological disorder that has been recognized since the early 19th century. In 1817, James Parkinson first documented the condition, and Jean-Martin Charcot later refined his clinical understanding. Parkinson's is primarily caused by the degeneration of neurons in the substantia nigra, a region of the brain that produces dopamine, a neurotransmitter essential for regulating movement. The loss of dopamine disrupts the function of the basal ganglia, which are involved in coordinating smooth and voluntary motor control. This disruption leads to classic symptoms such as tremors, muscle rigidity, and bradykinesia, with the motor cortex also indirectly affected due to impaired communication with the basal ganglia. Historically, understanding these brain interactions has been crucial for developing treatments. Although Parkinson's remains incurable, ongoing research into these neural pathways continues to shape therapeutic strategies aimed at improving quality of life. Lifespan implications are significant, as Parkinson's disease shortens life expectancy due to its progressive nature. By the time the symptoms manifest, much of the neuronal damage has already occurred, making early detection and treatment vital to prolong life and slow disease progression. As research advances, there is hope for new treatments that could further improve the outlook for those living with Parkinson's. Thank you for coming to my presentation.